Hello, thank you so much for joining us on the program Delta State Contributory Health Scheme and You. It's one program where we bring you details of how the Delta State Health Insurance Program runs. What are the benefits? How do you assess the care? What are your questions or reservations about the program? This is the right forum for you to air your opinion. Of course, my name is Eunice Emeyazia, your host, and I'm not hosting today alone. I have a co-host, and that's Patricia Bemudu.
Yes, thank you so much.
And you can see someone here is right here to also be with us. He's our guest, Dr. Alfred Ibiakofa. He is the Director General of the Delta State Contributory Health Commission. You are welcome, sir.
Thank you very much.
Our Obonga Oga.
And so I forgot to let you know that Patricia Bemudu is going to be our pidgin English woman on the show today.
Thank you so much. May I accept the local woman?
Yeah, local.
Because the idea for this program now make everybody, anywhere you dey, whether you dey hear the Oyibo or you know they hear the Oyibo, everybody go understand, participate. Now make us they bring the two languages. We no want make all these women sabi speak big grammar, can't use big grammar confuse us. So now make me dey here for my type of persons so that we can understand.
Okay, thank you so very much. Our topic that we're treating today, we are looking at the benefit packages in the Delta State Health Insurance Scheme. What are the benefits? What are the packages that you can enjoy? So let's go straight to our guest, Dr. Alfred Ibiakofa. What are these packages in the scheme?
Well, presently, the Delta State Contributory Health Commission has one benefit package that covers everybody. But we have different plans. You have the formal health plan, we have the informal health plan, and we have the equity health plan. The equity health plan is funded by government. The formal health plan is funded by deductions from the employer, in which case government also, because that takes care of those working for government and the organized private sector. So there's a little deduction from the employee's salary, and then a counterpart fund is also paid on behalf of the employee by the employer. So government and the organized private sector are involved in this. Then the informal sector, the informal plan is for those who are not working for government or the organized private sectors, like your artisans, the vulcanizer on the road, the market woman who sells things in the market, the bole seller, the tomato seller. All this group of people falls under the informal sector, and they pay a premium of 7,000 naira per person, and that covers them for 1 year in the benefit package.
Okay, sir. Before we ask you the next question, the lines that are open right now, please. The number to call is 0906 273 9107. The number again is right there on your screen. It is 0906 273 9107. Please do call us. Let us know your complaints. Let us know your experience. Let us know how much you have benefited from the program. Dr. Alfred Ibiakofa is the authority that is going to give you all the answers that you seek. So don't miss this opportunity. Our pidgin English woman wants to say something.
Yeah, my sister don't speak the grammar. He say we get number 0906 273 9107. When you go take talk to us, when you go take reach us, like I don't talk am before, say this program, wetin make us say make we start this program be say we don hear muli see about this program. We come say make we bring this program so that you go get opportunity to ask any question when you want ask. And you go get, like my sister say, we get our obonga oga when they here, when they ready to give us all the questions. So you no need to go ask somebody when go confuse you or can deceive you. Now it be this number. So now this time you get the opportunity, make you talk am as CB.
Okay. And so are there different benefits for civil servants and other residents of Delta State who pay that 7K premium?
No. The benefit is the same. For now, we have one benefit package that everybody enjoys from. And that benefit package covers up to 80 to 90% of the reasons people go to hospital. So it is the same benefit package that everybody enjoys. But you just need to contribute based on the area you fall into. So if you are a public, or if you are in the organized private sector, you fall into the formal sector. If you are working for government, you are in the formal plan. Then if you are among the vulnerable, children under 5, pregnant women, the government is paying for that already, so it's also covered. And then the informal sector, those who do not fall into these two categories, they pay 7,000 naira for 1 year, and they get access to the quality care that the other two groups are also receiving.
Okay, so I remember when we were doing the program on radio just now, somebody asked a question concerning the prescriptions and all of that. So are there prescriptions, ailments with prescriptions that are not covered in the scheme?
If the disease condition is covered, the drugs to treat that condition is also covered. But the problem we have is that some people have this psyche of branded drugs. Augmentin. Augmentin is a brand, it's not the name of the drug. And health insurance the world over deals with generic drugs. So Augmentin is something as amoxicillin clavulanic acid combination. So if you are given amoxicillin clavulanic acid combination, amoxiclav, there are different brands in it, different names in the market. But somebody will tell you, no, it's Augmentin he wants. That's a branded drug. The same thing with anti-malarial. Somebody will tell you that it's only Lunat that can cure his malaria, and it's absurd because Lunat is artemether-lumefantrine combination. Lumaten is the same artemether-lumefantrine combination. And one is sold for 1,800 because it is produced where the cost of living is high. And the other one is sold for about 600 naira because it is produced where the cost of living is low. So it is not the cost of the drug that makes it work. It is where it is produced. So a lot of people should take their mind off this. In fact, there are some cases that there's what we call a placebo effect. It is your belief in the person who is treating you and the statement he has made that will make that thing go. So sometimes you see some people that will come with different complaints, and the doctor, knowing that, okay, this person may not fall into any category of disease, will look at the person, talk to the person empathically, and then sometimes prescribe candy. They'll bring out candy and say this drug will cure you. And the person will take the candy and feel better and go back to the doctor to ask for that candy. But it's what we call placebo effect, and it only comes with the belief on the person you have. That's when you have faith on the doctor treating you. That's when that placebo effect works. But if you have no faith in what the doctor is doing, you maybe from the moment you enter, you've started disliking the doctor, the premises is not okay, this, that, and even if he gives you the most effective drug, it might not work because your psyche is wrong.
Yeah. Well, if there's something I have learned from here, this placebo effect.
The grammar too big. Oga, which one? Oga say the placebo effect. Now your disposition, the way when you take see things. Some of us don't think say like he talk. If no be Lonat, I no go dey well. So if they give you any other drug, that one no go work. Or it don't come. Now this doctor. Some of us they do am. Now you get one doctor when you get from mind. Now this doctor one, and you don't come another doctor come dey there say, now this doctor. anything when that person dey tell you no dey your mind at all because and this thing remind me, get one of my family doctor when dey take care of one old woman. I come say me I dey look am na paracetamol he bring, he come break am into 2, come say take one in the morning, take one in the night, na hard drug. Na so this woman say e don strong. I say why you give? He say nothing dey wrong with the woman. Say for the fact e don, and the woman come I say as the doctor touch me, touch my body, the whole sickness don disappear. And the drug when he give, I say the drug strong well na im make am break am na half. He say na im be this placebo effect my oga go speak for ogbonge grammar. So your disposition, your mindset towards the person who is treating you and the drug dem dey give you, na so e be o. Oga shey I time break am our language because the placebo effect the thing come sound too big.
And you know, you said something, it's not the cost of the drug that determines its effectiveness. This issue is very, very vital that you address, because I was a victim at the time, because there's this one medicine, albendazole. You know, it has different brands. So there was a day I went to buy a drug at the younger years. Then I went to buy this drug and they gave me, I've forgotten the name. And I said, no, it's not this one. There's one that we used to. He said, no, this is the same thing. I should look at the ingredient, the name, and then what it comprises. And I saw albendazole there actually, and I was like, no, this one might not work. Is that other one? That one was sold for 1,000 and something, but this one is I think 250 or something like that. I was like, no, please don't give me this one. Go and look for that other one. So it was as you know, knowledge increases, one gets to know that no, it's not about the cost. You know, the cost does not determine.
And now you know, say for this our country, when something na thousands, that thing dey best for. This one na small, and this one no go dey effective. And na so, like my oga don talk am, say for health insurance, we no dey deal on branding. Say the name of company. No, but you know, say to do advert, even for this una station, somebody to do advert, he go pay. So we know they work on advert, we know they advertise anybody. Now wetin the drug they treat, na him be our concern when they the health commission. So now make us organize this. Make people they learn every day. You self don't learn. Like say the
I knew that
be holding before.
I got to know that quite earlier. So what they are trying to tell you is that when you go to assess the healthcare, that whatever drug, whatever brand is given to you, the cost of that brand in the market does not determine the effectiveness of that drug. So have that in mind whenever you go to assess your healthcare. Okay, sir, this particular scheme, does the scheme cover primary treatment for all the ailments?
When you say primary treatment for all ailments, to us primary means just a minor condition. You understand? And the scheme covers, in the benefit package, we have disease conditions that, if you check our benefit package online, you will see a section that is called primary care. Then you see another section that is called secondary care. Now what we've done is that for those in the formal and informal sector, we pay the hospital upfront to take care of your primary care. And that amount is paid whether you go to the hospital or not. We pay that money upfront for them to take care of those minor ailments where you can just walk in, you're just feeling aches, slight fever, and you go in, the person look at you and gives you a prescription, you go to the pharmacy, pick your drugs, and then you go home. Those are the areas we classify as primary. You can go and get health education, talks on different conditions. Those are primary. They can go and have your BP checked. Those are primary. So these minor things are paid upfront, and we pay them through a fee we call capitation. It helps the facility prepare for you to come. Now, whether you go to the hospital or not, it has happened. We started paying capitation of some particular facility that had 630 persons. And in 3 months, nobody, not even one person, come to that hospital. But we paid them for each person, for the 630 persons. So that money is saved. But on the 4th month, they came in their droves, and The doctor wants to complain and say, remember the last 3 months you have been enjoying. Now this is time to pay back. So capitation is paid upfront to take care of the primary care, primary conditions. While for the secondary conditions, there is fee for service. In this one, the hospital treats you and sends us a bill. It is based on what they've done for you that they will bill us. So if they give you drugs, if they do a surgery for you, if they give you drip, anything they give you, they'll put it down in their bill and send to us. And we will pay them for that. We call it fee for service. That's what we do for secondary care. Now, some people say minor cases. I said, there are people who have hypertension. Hypertension in itself is just the diagnosis that is primary. The treatment of hypertension is secondary. The same applies to diabetes. Somebody who has diabetes can be walking around normal, doing his normal thing, but he goes to the hospital to get his drug refills regularly. So for those people, to get the refill is a secondary care. So we pay the hospital based on the drugs they give to you. So that is how it is classified. Primary care for minor ailments, while secondary care for more serious conditions that may warrant admission or surgery.
So in other words, this scheme, there is a free surgery.
Yeah. That's why sometimes when I hear people say, I have a friend of mine who runs a hospital in Warri, and he begged his friend to register the mother who was always coming, who he always bring around for treatment. And the woman, he told the man, look, every time you come, you beg me to give you discount. He said, register your mother in the Delta State Contributory Health Scheme for just 7,000. I will treat your mother. You will still bring her to this hospital. I will treat her, but I will send the bill to the Delta State Contributory Health Commission. They will not be begging me the way you are begging me. The guy refused. 2 months after, the mother came down with appendicitis. And the 7,000 he would have used to register the mother would have covered for that surgery. But he didn't. So he went to the hospital, they did the surgery. And his friend gave him a bill of 150,000. Wow. And he started begging. He said, look, 1 kobo, I am not taking off this bill because I warned you. I told you to register your mother in the scheme. You will still bring her to my hospital because I am a practitioner, but you refuse to listen. So you will pay every kobo of this 150,000. And the man has to sell his laptop to pay for the mother's listen. What if he had listened to the doctor, his friend, the 7,000 would have covered, and the 7,000 would have covered for other conditions that his mother is facing. But he refused to listen. So it's the same thing we are calling out people now. In that 7,000, if you have appendix, it will be operated for you free. If you have hernia, it will be operated for you free. If you have hypertension and diabetes, you can collect your drugs for 1 year free. There are some people who have malaria that is their property. They call it my malaria. This my malaria, don't come again. That itself, even if you have it monthly and the doctors can show that, yes, this man has malaria, they will treat you for 1 year with that 7,000 naira you've paid, free. But if you go and they tell you pay this, pay that, pay this in the hospital, please report to us. Report to us, because those are the people like our pigeon man who say that they won't spoil our gari. They won't put sand for our gari. We don't want that.
We don't want. We no agree.
So they should. If you have any treatment that does not dignify you, maybe you go and then somebody talk to you shabbily in the hospital because you are in the scheme, please report to us. Because we have many hospitals, because in the long run, the facility will be the loser. Because everybody, the scheme is mandatory. Very soon we will enforce the mandatory nature, but now we're just bringing people in gradually. Once we enforce the mandatory nature of the scheme and you are not in, everybody who has paid for something will not go to where is going to pay cash now. So at the long run, it is the healthcare provider that will be the loser if he does not treat our enrollees well, because they will definitely move to another place. So what we say is, if they don't treat you well, please come and report to us. But if they treat you well, then encourage others to register and enjoy what you're enjoying.
Okay, sir. I know you talked about this issue of free operation. The free operation, is it for those in the private or those in the public facility?
Like I told you, it's the same benefit package. So whether private or public, whether informal or informal, whether equity or this, it's the same benefits. So
in other words, if you are an enrollee in the program, it doesn't matter the hospital, whether you're in private sector or the public sector, you are entitled to every of the benefits. Our time is actually fast spent, but just before we go, sir, the premium package, does it cover emergency services like ambulance services?
Well, it covers, part of our package is ambulance service. We render ambulance services. If, for instance, you are in hospital A and they need to move you to hospital B, they move you with an ambulance, we cover that here. But then the State Ministry of Health has an ambulance service that you can call their numbers, and if you are in their conditions, you can call the numbers and they will take you from home to your hospital, the hospital where you want to go. But please, people should not abuse it and call them to come and carry dead bodies. They are not IASs, they are ambulances for people, living people who need emergency care.
Thank you very much, sir. Our Pidgin English woman wants to ask.
And so my God talk about. He say, like you always talk, say, health insurance now for people when they health, now they insure themselves in case of eventuality, in case they fall into sickness. So the health insurance no be, you know, cover dead body. So no be person don't die, you say, I did the health scheme. Oh yeah, come carry my course, and tomorrow you come begin talk say I call them when my papa or my grandfather died, they no come carry am, the health insurance no cover am. And if you look at this TV screen, you go see say our social media handles dey displayed there where you can follow us. You go follow us every day. Any question, if you even get question, ask am there. I will get people when they're ready to respond to your question. So you look at the TV screen, you go see all our social media handles. We on Facebook, we on Twitter, we on Instagram, and our head office is there too. People dey there when they're ready to listen to you. I beg, like I don't tell una, say this DSCHS and You program, when will they bring come una domot now, so that una no go dey deceived by people. When some people say I'm not registered for the scheme, but now they get the story part, then go carry the story, go talk wetin they no know. Now because they bring this program, ask the question when you want ask, you go get respond. We go always come on our way the same time next week.
Okay, so then before we let you go, sir, what's your message to our audience today?
Well, like a friend of mine says, 7,000 naira just means 2 bottles of beer and a plate of pepper soup, and you are insured for 1 year. He says it's too good to be true, but it is true. So 7,000 naira will save you that bill. Don't be like the friend of one of our providers that has to pay 150,000 when the 7,000 would have covered it. Enroll in the Delta State Contributory Health Scheme today and enjoy the benefits later.
Thank you so very much, and that's it on the program. My name is Eunice Emeyazia. Join us again next week for a fresh package. Bye for now.